had already announced the same plan. All schools and colleges in Ireland have been closed, though some in Northern Ireland are still open.
Believes 60% of the world's population could become infected with the virus.
They expect that there would be a likely sort of glut of test results, which will shoot up the positive rate, and that's something people should be prepared for. The president also, in his sort of wartime powers mindset, is going to call upon the Department of Defense
to send near Washington, D.C.
I can't believe what people are doing inside. Shelves are empty. It's like we're going to, I don't know where. It really is unexplainable.
The sudden push for preparedness has stores rushing to replenish. President Trump urging moderation from consumers.
You don't have to buy so much. Take it easy. Just relax. Take it easy. Just relax. Take it easy. Just
Many
relax.
stores now limiting the number of high-demand items customers can buy, like hand sanitizer and disinfectant wipes. Kroger and Target increasing staff, while they and many other retailers like Wegmans, Safeway, Trader Joe's, Publix, and others are cutting store hours. They need the time to restock merchandise.
Increase in a single day in the number of deaths here in Italy. And also we saw the largest increase in the number of new transmissions, of new cases in one day since this whole nationwide lockdown started about a week ago. Now that's a pretty terrible symbolic step, but we're probably going to see another very grim milestone today. Now, Italy is probably going to surpass China in the number of deaths that have come from the coronavirus, and we'll probably hear that in the next couple of hours. We don't know for sure, but we always get the statistics every day here in Italy at about 6 p.m., and that's when we'll see, very likely.
Buy so much. Take it easy. Just relax.
First one is for the virus. So the coronavirus is known as severe acute respiratory syndrome coronavirus 2. That's quite a mouthful. So it's been abbreviated to SARS-CoV-2, and this is currently causing a pandemic. So I'm recording this in March 2020. Globally, today, I just checked the WHO statistics. There were 167,511 cases. This is globally. And there were 6,606 deaths. In the United States, we've just started testing patients, and already there is a pretty sharp upswing in the number of cases.
Right there too.
Yeah, but there's. What's going on here? Like they have a lot against them.
And nobody is taking it sitting down. The New York Post reported that it has triggered fistfights in supermarket aisles in Australia, where one family inadvertently contributed to the crisis by ordering 48 boxes of toilet paper instead of 48 rolls, roughly 12 years worth.
Now she's sitting very comfortably on more than 2,000 rolls.
The BBC reported on an audacious armed robbery at dawn in Hong Kong. And in Japan, Sora News said that one shopkeeper decided the only way to protect his restroom from desperate toilet paper thieves was to draw up traditional curses to protect his stash of spare loo rolls. All over the world, news of the potentially widespread COVID-19 coronavirus infection has sent folks to supermarkets and drugstores looking to hoard essentials from face masks and hand sanitizers to non-perishable food items like canned goods, oat milk, ramen, and yes, toilet paper. Shoppers in different countries were driven by different reasons for buying out toilet paper. In China, folks who had no access to surgical masks went for toilet paper because, as Australian academic Nikita Garg said, there's a thinking that toilet paper can be substituted for tissues and napkins and to make makeshift masks. In Taiwan, toilet paper flew off the shelves because there were rumors that the island's paper stocks were being used to make surgical masks, which would subsequently affect toilet paper supplies. Authorities later had to deny that this was the case. In the case of countries like the United States, Canada, and Australia, panic buying and the need to hold on to as much toilet paper as one can carry is most likely driven by fear of the unknown, not by any proven or actual need for more toilet paper. Clinical psychologist Stephen Taylor explained to CNN, when people are told something dangerous is coming, but all you need to do is wash your hands, the action doesn't seem proportionate to the threat. Special danger needs special precautions. It doesn't help that news reports showing empty shelves urge people to believe that they're missing out if they don't go out and get more toilet paper right now.
There is an element of where you actually do get drawn into that, a psychology where you feel like you may miss out, a fear of missing out.
In Ireland, shoppers admitted to the Irish Times that all the panic buying was admittedly over the top, but they were doing it anyway. Researchers at INSEAD Singapore, where the city's toilet paper supplies were compromised early on in the crisis, said the panic buying there was also driven by an element of retail therapy. Except instead of spending money on the latest gadgets and fashion, folks bought useful items, as shopping for those things reinforced their sense of control over the crisis. People are also spurred by the idea that a community coronavirus outbreak could result in quarantine or a lockdown, which will impose restrictions on their freedom of movement. Psychologist Baruch Fishoff told CNN, unless people have seen official promises that everyone will be taken care of, they are left to guess at the probability of needing the extra toilet paper sooner rather than later. The fact that there are no official promises might increase those probabilities. More than anything else, there is a need to have a sense of control over a situation whose outcome no one can currently predict, and buying toilet paper could be one way of getting to grips with an unknown.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here and they're in terrible shape. This is an absolute constant. This killer pandemic is virtually out of control. The patients are literally gasping for air. The plastic bubbles the staff struggle to communicate through attempt to equalise the air pressure in the lungs. Nobody expected this. Nobody thought they'd be treating so many so quickly. And it's not like flu. It is chronic pneumonia, and it is killing hundreds each day.
There are now 15 patients.
The doctors say they've seen nothing like it before, and are warning other countries, especially the United Kingdom, that they will see it as well.
People have keep describing it as like flu. It's worse than that, no?
No, it's totally another thing. I think it's most pneumonia, more pneumonia than flu. Mm-hmm. Because most people get pneumonia. And as I said before, it's a very severe pneumonia. And so it's...
This is the main hospital in Bergamo, in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard-hit of all the hospitals in Italy. The town is the centre of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
What I would suggest is just shut down to stop all the outbreak and not come in this kind of situation that is very, very difficult to manage.
Can I ask you personally what it's been like?
I never felt so stressed in my life. I'm an intensivist and I'm quite used to, intense movement and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
We are performing the test for the nasal swab to detect coronavirus.
The problem facing health services across the world is that when the infection curve goes up, it rockets, and all the resources, all the testing, all the supplies are used up instantly. Multiple hospitals all at once.
What's staggering is that Italy is doing a lot of testing. Thousands upon thousands are being tested. So far, about 4,000, the numbers keep changing, have actually completely recovered. The crucial point is that about the same number are dying. They're sort of neck and neck. And it seems like you either live and recover, or you die.
You don't have to buy so much, take it easy, just relax.